They're not you. We're going to talk about nonverbal communication. Body language provides more information than words alone. Facial expressions, body language, and eye contact are sometimes physical cues, and they help people understand the messages being sent. Physical factors, noise, anything that dampens or obscures the true meaning of the message, and proxemics, which is study of space and how distance between people affects communication. Watch for their nonverbal communication. Look at their posture. Look how they're sitting. Look how they're standing. Are they standing there with their hands in the pocket? Or are they standing there kind of turned slightly sideways with one hand behind their back with a clenched fist? Their tone of voice. Are they talking politely? Are they yelling at you? Are they talking, maybe in a higher pitch than normal? We'll talk about verbal communication. This is asking questions as a fundamental aspect of pre-hospital care. And a lot of times, we may try to use open-ended questions which require some level of detail. You want to use these whenever possible. And an example of this is, what seems to be bothering you? We don't want to just walk up and say, Miss Jones, did you call EMS because you're hurting? Her answer is yes. Quick answer. Miss Jones, I'm let me go to Wayne County EMS. What seems to be bothering you today? Try to use open-ended questions to get them to talk more and to try to answer your question better than just a quick yes or no answer. We'll talk about that. We'll talk about closing the questions. They can be answered in very short responses. And responses is sometimes just that one single word, And the only time you do want to use this is when the patients cannot provide answers. If they're having trouble breathing, they can't get out a full sentence, don't ask them open-ended questions and make them come talk. Ask questions they can answer quickly. Are you having trouble breathing? They can shake their head yes. They can say yes. Just a good quick answer right there, and what's going on. Communication tools. There are many communication tools that the EMTs can use. We have facilitation. We have silence, reflection, empathy, clarification, confrontation, interpretation, explanation, and summary. And we will discuss these as we go through. Interviewing techniques. When interviewing a patient, consider using touch to show caring and compassion. However, use this consciously and sparingly. And you want to avoid touching the torso, the chest, and the face. It's okay to reach over, for a little old man or a little woman, maybe pat their hand or, pat them on the knee. But do so consciously and very sparingly. And once again, do not touch torso, chest, and face. And the golden rules to help calm and reassure a patient. Make and keep eye contact at all times if possible. Provide your name and use the patient's proper name. And tell the patient the truth. Never lie to your patient. Even if you think, the truth is going to get them agitated or hurt them or make them mad, always, always, always tell your patient the truth. Because if you lie to them once, you've lost that trust and you lost that camaraderie with them. And that's not what we want to do. The golden rule is also you use language the patient can understand. Don't use big anatomical words. Don't use big fancy school words that that Mr. Jones, who has been a farmer all his life, may not understand. Be careful what you say about the patient to others. Don't sit there and say something, turn your head to the side and say something to your partner about the patient that you don't think they heard, because sometimes they hear more than you know. Be aware of your body language. Be conscious of how you act, how you stand, how you do, and try your best to speak slowly, clearly, and distinctly. For the hearing impaired patient, you want to face the patient so that he or she can read your lips. And you want to allow the patient time to answer or respond to your questions. You always want to act and speak in a calm, confident manner. You always want to be professional and confident, and you want to let the patient know that you're confident in what you're doing.